Hi Brennan, it's nice to see you again.
Good to see you.
I know we just got your vitals, so I'm gonna go ahead and get started with the assessment, okay?
Sounds good. Vitals were all good?
Yep, vitals were great. Blood pressure was 112/80, which is how we like to see it. Everything else looked great.
All right.
So today we're gonna take a look at a couple things. We're gonna take a look at your blood vessels and do a extensive abdominal exam, okay?
All right.
Do you have any concerns or anything I should know about before we get started?
Mm-mm.
Okay, perfect. So I'm gonna go ahead and have you lay down, head of down there and your legs facing me, okay?
Okay. Want my socks off?
You can leave them on for right now. Okay. Are you comfortable?
Yeah, I am.
Okay, perfect. So I'm gonna stand at your feet and I'm gonna take a look at your limbs, and I want to ensure that everything looks symmetrical, okay? I want to look at your venous return, make sure your limbs are symmetrical, all of that sort, okay?
Sure.
And you don't have any problem, concerns, or anything of that sort?
No, my feet are sore. I just ran a marathon the other day, but nothing out of the normal.
Okay. Well, currently I can see that you're breathing appropriately. I don't see any like distress noted. Can you raise your shirt for me? Perfect. Okay. Don't see any muscle separation, no visible bulges, masses, pulsations, just with inspection. Limbs look symmetrical. I don't see any current skin issues that are visible to the eye as of this sort. And you're not having any noted issues, right?
Mm-mm.
Okay. All right. So like I said, don't see any masses, hernias, or any separation within the muscles of the abdomen. Go ahead and crane your crane your head for me and look up.
Like that?
Yep. Okay, perfect. Once again, no hernias, no muscle separations, no pulsations, no masses, lumps, bumps, anything of that sort that would be abnormal. All right, so with inspection, that is done. Oh, that was the one thing I forgot. Kind of lift, so hold your breath. Okay, once again, let go. No hernias, no masses, no pulsations, nothing of that sort upon inspection. Sorry, I forgot that portion.
All good.
Alrighty, I don't see any extension in your belly. Everything is flat and normal, moving as it should with a normal breath. I'm gonna go ahead and move on to the auscultation. Is that okay?
Sure.
Okay. So I'm gonna listen to your bowel sounds. And I'm gonna start from the right lower quadrant and kind of go up in a square motion, okay?
All right.
Okay. Right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Good. Bowel sounds are present and active in all four quadrants. So then I'm going to listen over your liver. I'm going to listen for any friction rubs, okay?
All right.
Okay. So don't hear any friction rubs really. I'm going to take a look and listen for your spleen. That was normal, no abnormalities. And I wasn't causing you any pain or anything, correct?
Mm-mm.
Alrighty. Okay, Brennan, so after auscultation, all of your bowel sounds, your liver, and your spleen, we're gonna move on to your arteries, okay?
Okay. Shirt up.
Alright, so first I'm gonna listen to your aorta artery, and that is above your umbilicus and a bit to the left. I'm going to go ahead and listen to your femoral arteries, okay?
Mm-hmm.
And then I'm going to go renal artery 3 centimeters above and laterally. Good. And then I'm gonna listen to your iliac. And your renal again. Okay, perfect. Everything sounded accordingly. No abnormalities noted there, which is great. Do you have any questions about anything we've done so far?
No.
Okay. Okay, so the auscultation portion of our exam is complete. I am going to start the percussion form of the exam.
Okay.
So that's when I press and kind of palpate, or I'm sorry, not palpate, but like kind of see if I can get a sound or a feeling out of it, okay?
All right.
Alright, so with your liver, it should be like a dole, and then something with this, such as like your spleen, would be what we call tympany. And then, so I'm just going to go ahead and palpate all 9 quadrants, okay?
Okay.
Okay, so if you want to go ahead and raise your, thank you. Okay. Not causing you any pain, right?
Nope.
Okay. I did feel dullness over the liver. I did feel tympany over the spleen. And then I'm going to just document and ensure that I've gotten everything written down appropriately. Okay. Next on the docket is I'm going to look for a gastric air bubble, and I'm going to kind of percuss again, okay?
Okay.
So I'm going to be at the 5th, 6th intercostal space at the midclavicular line. And I do feel tympany, which is normal, which is good. Alright, so then I'm going to go ahead and move on to the liver measurement. I'm going to kind of place some pieces of tape and measure your liver, okay?
Okay.
So I'm going to go ahead and percuss down from your lungs, and then I'm going to listen for sounds, and then I'm going to mark it, and then normal span is usually 6 centimeters to 10 centimeters, so we'll go ahead and measure, okay?
Okay.
Okay, alrighty, so I'm going to start your 1. Okay, feel there. I'm going to put a piece of tape. Your tattoos make it easy. Alright, I'm going to go ahead and measure. And you are at exactly 6. Perfect. Good job, that's normal. Alright, I'm going to take these off of you. Do you have any questions about that? Okay, perfect. Alright, so I am going to go ahead, and since we were done and I felt the dullness and we'd measured it, I'm going to go ahead and have you sit up. And I'm going to go ahead and percuss where your kidneys are, okay? Perfect.
Is that easier?
Yeah, I'm going to raise your shirt here. Alright, I'm going to place right where underneath your rib cage is. Okay. And you're going to kind of feel me strike with the ulnar portion of my hand against my other hand, okay?
Okay.
Perfect. And then I'm also going to go to the other side, okay? Under your rib cage. Okay, good. Feels completely normal. Alrighty, so we're going to go ahead and move on to the palpation portion of the exam, okay? Nothing I've done so far has caused you any pain, right?
Mm-mm.
Okay, perfect. Alright, so I am going to go ahead and have you lay back down again. I know it's kind of some up and down. I apologize.
That's okay.
So I'm actually going to, I spoke too soon. Keep sitting up. And that didn't cause you any pain to sit up or lay back down, right?
No.
Okay, go ahead and lay back down. I wanted to make sure that nothing was hurting you within your muscles to sit up. Yep. All right, so I'm going to start with a light palpation on all of your quadrants. I'm going to be looking for any muscle resistance, tenderness, masses, or bulges, okay? Go ahead and raise your shirt again for me. Okay, light palpation. palpation. I'm not hurting you, right?
No.
Good. All right. Now I'm gonna go a little bit deeper, and you make sure to tell me if you feel any pain. Okay?
You got it.
No pain?
Mm-mm.
Good. Okay. All right. I'm gonna go ahead and feel for some of your organs, okay? So I'm gonna be taking a look for your liver, gallbladder, and spleen, okay?
Sounds good.
Comments, questions, concerns?
Nope.
Okay. All right, while I have you on this side and angled, I'm gonna go ahead and look and palpate for your kidney that's on your left side and your spleen, okay?
Okay.
That involves using the back of my hand and kind of pushing back through.
You can flip.
Nope, you're gonna just stay just like that, and I'm gonna actually have you, if you can, rotate this arm up so that I can get a better view, okay? So I'm gonna kind of come up between your 11th and 12th rib, and I'm gonna push up, and I'm going to palpate up towards your armpit, and I can feel your spleen. All right, and then I'm also going to push up on your back and press down to feel your kidney. Okay. All right, this time I'm gonna have you sit up and flip your legs the other way so that I can get to your other portion of your organs, okay?
Okay. I'm bringing my pillow.
Okay. Okay, so I'm going to put my hand under here again, and I'm going to assess your gallbladder, okay? Perfect. So what I'm doing here is I'm going to place my finger under your liver border. I'm going to have you take a deep breath in and hold it. Good, let it out. Was there any pain with that? Okay, good. So what we just did is the Murphy sign. No pain typically indicates negative results with your gallbladder. If you were having like abdominal pain and that was positive, we would be concerned that there would be an issue with your gallbladder. Does that make sense? Perfect. All right, so I am gonna go ahead and move on to your other kidney on this side as well.
All right.
So once again, kind of same deal. I'm gonna push up and down, and it feels good. I don't feel any, pulsations, masses, bulges, anything that shouldn't be there, which is good. All right, and then this time I am putting underneath the 11th and 12th rib and pushing deep, and I'm going to try and feel your liver. And I don't, which is good, which means it's not enlarged. So good. All right, if I could feel it, it should be like, firm and smooth. Okay, good. Was that painful at all? Okay, all right. So I am then going to look at some aortic pulsations. So I'm going to use my thumb and forefinger, and I'm going to go above your abdomen and slightly left so that I can feel, and it's usually about 2.5 to 4 centimeters. So there's there. I'm going to use my tape measure here again. And your tattoos, again, make it really easy.
Happy to help.
And you are at 3.5, which is good, and that's normal. All right, and then going to look and feel for your appendix. So I'm going to kind of come up from here and push down. Hold your breath. Okay. Good. Any pain? Okay. All right. So once again, if you are having any pain in your appendix, we would typically take a look there and apply steady pressure and then let go quickly and assess for the pain, okay? Okay. All right, so that conducts the portion of our abdominal exam. Do you have any questions?
No, I don't think so.
All right, we're gonna move on to blood vessels, okay?
All right.
Okay. Alrighty, and like I said, we're gonna move on to the blood vessel portion of the exam. So I am gonna start with an initial inspection. I don't see any wounds. I don't see any abnormalities in color. I don't see any varicose veins. I don't see any texture issues. Hair is distributed appropriately and evenly. Are you having any current concerns for blood vessels or blood return or anything of that sort?
Mm-mm.
Okay. All of your muscles look appropriate, especially with how much you work out. I don't see any edema or swelling or anything abnormal, which is good. I am then going to move on to palpation. I want to ensure the rate, rhythm, contour, and amplitude of your vessels are appropriate, okay? Okay. All right, you want to hold up your fingers for me? Please. Perfect. I don't see any clubbing, which would be indicative of an issue with some oxygenation. No cyanosis, nothing of that sort. So I am going to go ahead and move on to palpation of your vessels, like I said. So I am first going to feel for the carotid. Good. Regular rate. Say at least +2, which is appropriate. Good. All right, I'm going to sit here next to you, and I'm going to feel for your brachial pulse. I'm sorry, your radial pulse, and then your brachial. Both +2. All right, radial pulse. Brachial. Good. Rate is regular. Say +2. And then say that it sounds really good. I'm going to go ahead and move on to your femoral. Once again, +2. Feels appropriate, rate regular. All right. I'm going to go to your popliteal, which is behind your knee. +2. Once again, regular distribution. It's matching, bilateral. Okay, I'm gonna go to your dorsal pedis. Good. +2. Regular rate. Good. And then your posterior tibial. Good. Regular rate +2. Good. And all of your extremities sound feel warm, they're dry. I don't feel any temperature issues. Pulse quality was good. There was no tenderness with anything that I did, correct? Okay, perfect. I didn't see any pitting edema. I am going to check your calf refill here shortly. Quick little pinch. Good. All right, this hand too. Good. All right, I am going to remove your sock if that's okay. All right. I'm gonna pinch your toes here real quick. Your toes are black and blue.
They sure are.
Is it from running your marathon?
Yep.
Okay, good. Cap refill was less than 2 or less than 3 in all extremities, which is good. All right, we're gonna move on to auscultation. I am gonna go ahead and listen for your carotid. I did auscultate all of your other arteries that I would need to in earlier on the exam. Use the bell. Okay, good. Sounds normal. I didn't hear anything abnormal. No extra sounds, no murmurs, nothing of that sort. It sounded all appropriate. I am going to look at your jugular veins. I know we did this previously in our other video. But I want to ensure that there's no jugular vein distension. And I'm going to measure a little bit on your neck and then use a light to look at it, okay?
Sounds good.
All right, I'm going to begin with the jugular exam, okay? So once again, I'm going to kind of use a light to take a look here. I'm going to have you turn your head to your right. I'm going to take my tape measure here and go ahead and again, oh, you haven't changed, sorry. Okay.
You're good.
All right, I'm going to go from the angle of Lewis and you are at 8.5, which is good. I'm gonna have you rotate so that I can assess the other portion of your neck. Is that okay?
Yeah.
I'm gonna take. Well, I'm gonna need you to.
Oh, sweet.
Yeah.
Hey, thank you.
You're welcome. Okay, look to your left again. Okay. Make sure this is in centers. Okay, and once again, you're at 8.5, which is perfect. All right. Well, we are done with the JVD. I didn't see, or the JVD exam, I didn't see any presence of JVD, and your exam looked appropriate and normal for there. Do you have any questions about the rest of the exam?
Mm-mm.
All right, well, I thank you for your time, and I hope you have a good rest of your day.
Well, thank you.
You're welcome. See you next time.
Yep.